Did you know that you're supposed to live 120 years? Yet most people in the U.S. die in their 60s, 70s, and 80s. Welcome to Longevity with Dr. Wilcox. For the next 60 minutes, we're going to add years to your life. The phone lines are open at 731-1230. That's 731-1230. Or toll free. 1-866-820-5528. That's 1-866-820-KLAV. Now, let's bring on the host. Here is Dr. SImmon Wilcox.
Good morning. We're glad to be back with you today. I am Dr. SImmon Wilcox. I am a board-certified family physician, former emergency room physician, and I'm currently completing the stem cell fellowship. We're glad to be here. I want to identify for you some things we talked about on Monday, and understand the show is an attempt to deliver complicated subjects in a fashion that makes it easier for you to absorb, to become empowered with information, and to make changes in your day-to-day life as it relates to your health, as it relates to your future, and try to maximize the quality and the potential of your longevity based on what your DNA will truly allow you to do. Last show we talked about telomeres, and as I defined for those who were not with us, that telomeres is the tail on your cell. Every cell has a tail, and that tail at the end of the day tells the story of your life in terms of its longevity, because as that tail shortens, your longevity becomes less and less. And at birth, that tail is long. As one reaches 60, 70, and 80, that tail progressively shortens. So it's important to do those things that reduce the damage to those tails, because at the end of the day, if you allow ongoing oxidative stress from what we call free radicals, which is from the foods we eat, particularly when we eat the wrong foods, when we allow toxins in our life, when we absorb toxins, when we beat our body up with certain chemicals, including alcohol, we ultimately shorten our telomeres and at the end of the day, shorten our lives. We talked about how stress in the studies confirm, particularly in young children who was exposed to violence as a form of stress, that their lives, at the end of the day, their telomeres was in fact shortened, and the studies then conferred that their life would be shortened because the telomeres were shorter than the controls who were not exposed to violence. I want to thank all those who called in after the show, and I was surprised by the calls we received from Texas. We're located here in Vegas. I guess that's from our internet audience. And they had some questions that I think it's worthwhile reviewing when they called me after the show. And one caller asked me to better define the concept of progenitor cells. The progenitor cells, PRO, progenitor cells, are cells that actually we all have. They live in our bone marrow. These cells are cells you're born with, cells that have never differentiated. And when used in stem cell treatments, you can take those cells and place them in certain parts of the body, whether it's the heart, the brain, etc., and it becomes very much like that environment. It replicates that environment. So we're all walking around with progenitor cells, whether we're 5 years of age or 95 years of age, we have progenitor cells. As you age, those cells replicate, but they do not differentiate. So they're still very rare. They're still very raw. They're undefined. And so because of that is the essence of the stem cell technology. You have cells there, undefined, undifferentiated, which have the potential to become anything, any particular organ. The only difference between the cells that you're born with, which have very long telomeres, the cells of a 70 or 80-year-old individual have very short telomeres. So those cells, if they're used to perform various treatment modalities, replication of tissue in the knees, the meniscus, the ligaments, if they're used to perform treatment of heart issues, etc. Those cells still have a short longevity because they're 70 years old, but they have not differentiated. Thus, the example we gave where Dolly the sheep from a few years ago, when they cloned the sheep Dolly the sheep died of old age. She died young of old age because she had cells that were older, although she was only a few years old. So she had old age issues at a very young point. So just want to review that, and that was a couple of the inquiries of calls that returned after the show was over. Let's look at for a minute the brain. As we indicated, the brain at birth, you have X number of neurons. Those neurons actually will increase up until 5 years of age. By 5 years of age, you have about 90% of all the brain cells you're going to have. And between 5 and about 8 or 9, you pretty much max out on the number of brain cells you're going to have. Once the brain cells have developed, that's all you get. They don't replicate, unlike the cells of your cheeks, unlike the cells of your heart, unlike the cells of your intestines, unlike the cells of your eyes. Every other organ have the cells will replicate. The time variance may be different. Neutrophils in the blood may replicate every 4 hours. Cells of the bone may replicate once every 5 or 6 years, and muscles may replicate every 9 or 10 years. But at least they replicate. The cells of the brain do not replicate. So you have to be very protective. And I think intrinsically we understand we need to protect our brain. Intrinsically we understand that the brain is very special. But many of us are not aware of the fact that the brain does not replicate the cells beyond a certain age. You are left with what you have, and you need to protect that going forward. Because what value of it is for you to make it to be 105, 110, and the brain's not working? That's our very fear. No one wants to be 115 years of age and crippled and compromised and living in a nursing home. So the brain is very peculiar and very special. And there's been a lot of media attention to the brain in the last 7 or 8 days, and it's mainly because the Professor Regina Verma from University of Pennsylvania released her long-standing study. And that study was looking at how the brain is wired, how a man's brain is wired compares to a female brain. And she revealed some very interesting things. I think we all know at some level that there's something different between about a man versus a woman. And what she confirmed was that there's two halves of the brain that we already know, right and left hemisphere. For the females actually have more connections between the two hemispheres, between the right hemisphere and as opposed to the left hemisphere compared to a man. So there are more connections between the right and left hemisphere for females. For men have more connections within each hemisphere and less connections between the hemispheres. As a result, females are better able to multitask than men, and females have a different response emotionally than men because of the way the wiring has been structured. And so it's interesting that we finally have confirmation that there is a difference in the wiring of the brain between male and females. The male brain is actually, I almost hate to say this, is actually bigger, because even though it's bigger, it doesn't mean we're smarter. It's just bigger. So many people say, "Oh, I'm smarter than a woman because my brain is bigger." That has never been proven. There are no studies even suggesting that. So those men who are using that argument, I have to call them out and say, "You're wrong." There is no clear suggestion that the bigger brain allows you to be more functional than someone with a brain that's slightly smaller than yours. But it's interesting that the multiple characteristics that the brain allows to occur based on whether you're male or female. We know that the females, as a rule, have actually handled stress differently because of the brain. Females are actually better suited to learn multiple languages. because females have what we call a larger limbic system than men. They're more in touch with their feelings, better able to express their emotions. It's all about the wiring of the brain. When it comes to mathematical skills, because of the difference in the inferior and parietal lobes, that we know that men, as a rule, do better on standardized tests, although women can be trained to be equal or superior over a period of time. So it's interesting to note that there are some real scientific differences between the sizes of the brain, and there are some things that it leads to in terms of how one interacts in life, in relationships, in church, in the community, and it's all based on how our DNA at the end of the day has wired our brain. One other question came up the other day, and it was kind of the big elephant in the room. I think Tony in the studio asked that, and I told Tony I would address it on the show. And the question was, Dr. Wilcox, what is the cost of all of these products you're talking about? What is the cost of the plasma-rich therapy program, where you inject your platelets, you spin down your blood, you take the buffy coat, the top part of the plasma, and you inject it into the joints. This plasma-rich platelets is typically ranging from $400 to $700. Some of the insurances actually cover that. It's kind of a mini stem cell procedure. You see signs around town about it, but it's a $400 event. Those procedures where we talked about, where one takes one's progenitor cells and actually make them into cardiac cells, and that has to be done in the university setting, and then you turn around and inject those cells into the heart to make a new heart muscles and new heart vessels. If you're lucky enough to go into a study, there's no cost to that. If you're doing it with a private individual who happens to be working at an institution, it could cost upwards of $60,000 to $70,000. And insurances, as a rule, will cover a piece of it, but the majority ends up being private pay. So you can go anywhere from $400 for the simple joint issues and joint replacement, to as much as $50,000 to $60,000 for the complicated issues relative to heart regeneration, of muscle regeneration of the blood vessels. Let me say the lines are open for questions. Please call us at 702-731-1230, 702-731-1230. The lines are open for questions. We're about to take a station break here at KLAV 120 AM. KLAV 120 AM. Call us at 702-731-1230.
Just in time for the holiday season, Dr. Wilcox is offering an exclusive deal for KLAV listeners. Get a free 15-minute consultation with the purchase of a vitamin B12 injection, half price, Myers cocktail, half price, or glutathione injection. For more info, call Dr. Wilcox's office at 702-900-2953. Better act fast. This is an offer on a first-come, first-served basis to a maximum of 10 patients per day. Visit Dr. Wilcox's office in Summerlin, 8751 Charleston, Suite 210, behind Fleming Steakhouse. Don't miss out on this exclusive holiday offer. Call Dr. Wilcox's office at 702-900-2953. Are you having difficulty detoxing from drugs or medication? Let Dr. Wilcox help you. Call at 702-900-2953. His revolutionary detoxing program is designed to help you detox without the discomfort of other procedures. Call him at 702-900-2953 or visit his office in Summerlin at 8751 Charleston, Suite 210, behind Fleming Steakhouse. Call Dr. Wilcox at 702-900-2953.
Just about 4 years ago, I was longboarding, hit the side of a truck. This coming spring, I will have had 7 different surgeries. I'm sent home with the oxycodone and the Percocet. The dose milligram, it didn't change, but how often I would take them did. I wanted to stop. These withdrawal symptoms are something that I wish upon no one. That's where the help comes in. I went to my doctor, Dr. Wilcox. He claimed withdrawal free. It was literally a miracle. I feel, I would say 100% better.
I'm Dr. SImmon Wilcox. I've been practicing medicine for the last 23 years. My passion has been drug and alcohol dependency, particularly methamphetamine. So what I've done in my practice, I've re-engineered how we approach the detox rejuvenation process. We offer a series of intravenous treatments. You go through a process where you don't feel any symptoms. My staff's priority is to ensure you're not having that discomfort.
For more information on this miraculous treatment, call Dr. SImmon Wilcox today at 702-900-2953. Once again, that's 702-900-2953.
Today is the first day of the rest of your life. This is Longevity with Dr. Wilcox.
We're back. Just want to remind you, if you want to call into the show, we already received several phone calls patched into our cell phones from our office, but if you want to call into the show and make an inquiry, to ask a question, to gain clarity, please call 702-731-1230, 702-731-1230. A number of callers are already calling into our offices, patched into our cell phones, but we would like the entire audience to hear the questions. JR, there was a question?
Yeah, I was listening to a study the other day, Doc, and they're talking about Alzheimer's and how Alzheimer's is basically an attack on myelin in the brain, and they're spending billions and billions of dollars to try to find a cure for that, but they're not spending any money to try to stop it from happening, to prevent it. Is there things that we can do now, even in an elderly age, even I'm in 53, to help guarantee that, or not guarantee, but to help me think that I may not have Alzheimer's, or trying to.
Exactly. I think I understand the question.
What I'm saying? Try to do some preventative maintenance still.
What can we do in a proactive way?
Yeah.
I think if we look at what Dr. Amon, who has the brain clinic over in California, and I think he has another clinic in Texas and one up in Washington, D.C. If we look at his work, if we look at what Patricia Kane, Kane, she's a brilliant biochemist and MD out of Philadelphia, who actually helped train me about 17 years ago. When you look at their work, they're clearly saying a lot of the same things. The omegas, if consumed in appropriate portions on a daily regimen, makes a tremendous difference. It's all about brain health, and so what you want to do is you want to eat the right kinds of foods. The vitamin D3 we've talked about, right. The vitamin C's we've talked about, and you've got to be responsible for making decisions about the toxins that you allow into your household, that you allow into your body, because that's the only way to protect against what's transpiring. For those who want sort of a preventive health tune-up for the brain, in the office, as we've said before, we give intravenous omegas, because the omegas actually help rewire the covering for the brain. That's the myelin sheet, because if the myelin gets disrupted, then the signals become sporadic and discoordinated. And at the end of the day, that's part of the process that leads to the Alzheimer's, the Parkinson's, the ALS, because at the end of the day, they're really essentially the same pathology leading to this disability that people are receiving at age 70, age 90, etc. Many people think just because I happen to eat a lot and I happen to be overweight, that being overweight means they're eating a lot of nutrition, that they have excess nutrition. And in fact, most people who are overweight are malnourished from a nutritional standpoint. They do not have the nutrients that they may assume they have. Remember, 60% of the individuals who struggle, who are challenged with excess weight, live in the United States. 60% of the individuals in the world who are challenged with excess weight live in the United States, and we only make up about 12% of the entire world population, but they're here. So there's so many people in our country who are deficient in nutrients, again, because the food we eat is grown in soil that's deficient in nutrients, because the food we eat is often coming from a commercial standpoint, and we don't have. They have to extract out the omegas in particular, because you can't allow. They need to have a loaf of bread to be able to sit on the shelf for 2 or 3 weeks, not 2 days. And if you leave the omegas in the food won't have the lasting power. And from a commercial standpoint, you have to extract the omegas out of the food so that you can have the shelf life. And so it makes financial sense then to make the volumes, to put food on the shelf that can sit there for weeks at a time. So we always have to make choices in terms of our food purchases, and realize if something's able to sit on your shelf for 2 or 3 months at a time, or 2 or 3 weeks at a time, there's something extra either in it as a preservative, or something been extracted from it to allow it to occur. And the biggest thing that's been extracted from our food supply has been our omegas. So the need to supplement. So flax seeds.
Right.
People should. I sprinkle flax seeds on everything. I sprinkle flax seeds even on my couscous, which is a raw food by itself, is a natural seed. But the flax seeds, the chia seeds, all those items there, and as well as taking the omegas orally. Again, we give it intravenously, and we've given it intravenously for people who have the Parkinson's, for people who have the Alzheimer's, people who have the dementia. And as you saw, I think just last week, the individual after receiving a few rounds of the omegas stopped shaking. Yeah, that was awesome. After shaking for 7 or 8 months. So it's all about the rewiring of the nerve system. It may not cure the problem, but it's a drastic improvement in the quality of life individuals receive when they can raise their omega levels to the right point. And many of us in the country who choose to buy food from wherever, assuming that because the food tastes good, that the food has quality, and that's a misnomer. That's an assumption that's not whole, and as a result, we continue to get these degenerative diseases in our 60s, 70s, and 80s.
Yeah, I was told when I was working on my weight, I was told by my personal trainer that if you eat something, if it tastes good, spit it out.
It's hard to do and live in America.
It's hard to do.
Absolutely, that's a major commitment. That is a major commitment. I have to share that with some of my patients. If it tastes that good, spit it out. Let me move on. Just want to talk, and I promised individuals last week I would do this, and I did not. To look at the issue of the distended belly, the issue of abdominal girth, the issue of increased abdominal fat. One of the things that I find that individuals with these large abdominal girth, with these large bellies, it is not always fat. That yes, there's fat there, but when I can put someone in the hospital, put them on an IV, and 8 days later, the belly is half the size, I know that large girth was not necessarily fat. Therefore, a lot of us, we're bloated. And that bloating is coming from eating our foods too fast, so we're swallowing air. The bloating is coming from drinking carbonated drinks, and most models will tell you they don't drink carbonated drinks before they go on the runway, because they don't want to have this bloated belly. Carbonated drinks will bloat your belly. You're going out in the evening, ladies, and you're going into a special affair and you want to fit into that dress, and you don't want that pouchy looking stomach, don't drink any carbonated drink the day of that affair, because you will surely have a bloated belly as a result of it. And then there's the touchy subject of bowel movements. Touchy because people don't like to talk about it. And I was talking to a patient the other day, and I hear this all the time, Doc, I have one bowel movement a week. Wow. And I said, you really should be having 3 or 4 a day. And well, I feel fine. I go once a week and I'm happy with that. Part of the problem is that you don't have the sensation to have a bowel movement until the stool reaches the last 7 to 10 inches of the colon. And that's when you have the sensation. Many of us are walking around with 10, 15, 30 pounds of stool in our belly every day. And that's adding to the distension. It's not body fat, it's distended belly, because our bowel movements are not frequent enough. Now, I'm not promoting frequent bowel movements just from an aesthetic standpoint, but clearly if you're going to reduce the size of your abdominal girth, what you want to do is get to 3 bowel movements a day.
Well, even one thing other, Doc, with the with all that toxicity in your body, it can't be good for you, is it?
Good point. There's something called rapid transit time or transit time, and the faster your transit time, the less likely you are to develop carcinogens. When you ingest vegetables, it usually processes and clears within 24 hours. When you ingest fish and chicken, again, between 24 hours to 30 hours it clears. Red meat can take 3 to 4 days for your body to clear it. So the longer items remain in your intestinal tract, the longer it remains in your intestinal tract, the more likely it is to become a toxin. And the more it sits there, the more is likely to help promote carcinogens, which are cancer-causing agents, cancer-causing toxins. So if it sits there for a week, you got a problem. You sooner or later, you're going to have a problem. If your food is sitting there for a week. So we have to almost sometimes retrain our bowel the same way we take our kids and sit them on the potty and say, sit there until you have a bowel movement. If you're trying to move them from diapers to socialize them so they can go to the bathroom. Many of us as adults, because of the pressure on our lives, actually will ignore the urge to go to the bathroom. We'll hold it. Sometimes we hold it because we can't find a bathroom we're happy with. So we say, I'll wait till I go home. But that's an unnatural response. I mean, we really need to be able to go when the urge is there. Every time we eat, within an hour or two, you should have a bowel movement every time you eat. So if you eat 3 times a day, you should have 3 bowel movements a day. So basically what we're saying is some people are eating 21 times, 7 days a week, 7 times 3, 21 times, and only having 1 bowel movement for 23 rounds of food ingested. You set yourself up for a problem. You've got to redefine your habits. You need, for your own sake, you need to redefine what you're doing wrong that will allow you, and adjust it so it'll allow you to have multiple bowel movements, because toxins sitting inside the gut is not good. You got to be able to move those toxins.
And as unfortunately, my sister passed away this last year here with colon cancer, and I know she was on a lot of pain meds prior to that and things of that nature, and I think they may have played a role in her cancer as far as backing her up, stopping her up because of the binders and the medications and things of that nature. And so the opiates cause a backup. It was one of the things that I just noticed in my own personal family history that's caused an issue. And again, she's being diagnosed with colon cancer.
And we see that a lot. Pain medicine, unfortunately, has the undesirable result side effect of constipation. So I often will give individuals laxatives along with their pain medicine so they would have an adequate bowel movement. And for those people who was already having 1 bowel movement a week and now you put them on pain medicine, that time gets extended often to once every 10 days. And you wonder why the belly is getting extended. Let me say we're going to go to break here in a moment. That please feel free to call in 702-731-1230, 702-731-1230. We at KLAV 1230 AM. KLAV 1230 AM. Please call us at 702-731-1230.
We'll be right back.
Just in time for the holiday season, Dr. Wilcox is offering an exclusive deal for KLAV listeners. Get a free 15-minute consultation with the purchase of a vitamin B12 injection, half price, Myers cocktail, half price, or glutathione injection. For more info, call Dr. Wilcox's office at 702-900-2953. Better act fast. This is an offer on a first-come, first-served basis to a maximum of 10 patients per day. Visit Dr. Wilcox's office in Summerlin, 8751 Charleston, Suite 210, behind Fleming Steakhouse. Don't miss out on this exclusive holiday offer. Call Dr. Wilcox's office at 702-900-2953.
My name is Dr. SImmon Wilcox. I'm a board-certified physician in family medicine. As a physician, I have 20 years' experience with drug and alcohol abuse. But I bring to you a new service at my facility for drug and alcohol. We're asking you to examine your household, your family, your community, and decide if there's someone there who needs what we have to offer.
Call Dr. SImmon Wilcox at 702-900-2953. Once again, that's 702-900-2953. Are you having difficulty detoxing from drugs or medication? Let Dr. Wilcox help you. Call at 702-900-2953. His revolutionary detoxing program is designed to help you detox without the discomfort of other procedures. Call him at 702-900-2953 or visit his office in Summerlin at 8751 Charleston, Suite 210 behind Fleming's Steakhouse. Call Dr. Wilcox at 702-900-2953.
Longevity with Dr. Wilcox continues. Here again, your host, Dr. SImmon Wilcox.
We're back. We're taking phone calls, 702-731-1230. We got a call just now from Mike, one of the patients, who said, "Oh, Doc, remind me what happened when I went on my testosterone." And we've talked about this on an earlier show, but remember that testosterone, I'm going to come back to the abdominal girth because that's something I really want to say about it, but this actually applies. Testosterone improves your mental agility, improves your muscle tone, improves the integrity of your bone. But one of the things that happens that with people on testosterone, they get a 20% reduction in their spare tires in the abdominal fat without exercise. So Mike just called me to remind all of you that he gained both energy and abdominal fat reduction.
You know something, Doc, is with our friend Mike is you know, he was sluggish, he was tired, he was distressed, disrupted, seemed like he didn't want to get out of bed, you know. And he runs with a pretty hot looking girl. He says he didn't even want to, you know, entertain her as well. And I said, it sounds like you're testosterone deficient. But he's a young man. And I said, well, how can that be? But you mentioned to me that he had some car accidents and things that he was on some opiates, and he says those will actually depress your testosterone even in a young man.
Everybody on pain medicine, from my standpoint, needs to be tested for the testosterone. The majority of people who've been on pain medicine more than 60 days will have a low level of testosterone because the opiates make it lower. If you don't correct it, what's going to happen is 90 days out, 120 days out, they're going to go to the doctor and say the medicine's not working. And not that the medicine's not working, but the medicine has caused a decrease in the testosterone level. Now when that happens, the pain becomes more profound, and the pain medicine not as effective. And so your choice is give more pain medicine or fix the testosterone. And the better answer is really to fix the testosterone.
And there's not a lot of pain docs that are out there that are really knowing this.
Well, the information, I used to be paid by the pharmaceutical companies to go around to pain doctors to explain this, but it's not something we've learned in medical school, and that's the problem. A lot of this information has come out since one has exited medical school and one has exited their postgraduate training, and so this is new revelation that's come to the table, and so it doesn't filter down as fast or as smoothly. So there's certain portions of the population that will receive the information and act on it. Others that have not received it yet. So it's just a matter of where you get your postgraduate information from that determines who knows and who doesn't know. And that's what we try to educate people on the show here, so they can go back to the doctor and say, "Doc, would you mind checking my testosterone level?" But before we get too far away from the earlier topic on abdominal girth, probably one of the most important things that we want to recognize is that a lot of people are having food allergies. And it's not the kind of allergy where you get a swollen lips and swelling of the face and you're itchy. It's the type of allergy where, you know, I try to be physically fit. And you can, some people will eat 2 spoons of oatmeal, which is supposed to be a good food.
Sure.
And find themselves having a bloated belly within a half hour. If I eat a half a slice of white toast in the morning, within a half hour, my belly's bloated. So I'm having an allergic reaction, even though I feel well. That bloating for a lot of people is allergic reactions they're having to foods that are perceived as natural, foods that are perceived as good for you, foods that are perceived as the kind of foods you should be eating to reach longevity. Yet, even though by definition the foods are great, they're in the right food groups, you may be allergic to the foods that you eat, but the only presentation of your allergy is a bloating belly. No itching, no swelling, no discomfort, no shortness of breath, just a bloating belly. And a young lady the other day said, "Doc, every time I eat this tomato, the only thing that happens, I realize within an hour or so my belly's bloated. I feel fine, but all of a sudden the clothes I put on in the morning aren't fit me by lunch."
Wow.
So it's a new revelation, and I urge you to, and I'll talk about it in a minute, the book called The Plan, just Plan, The Plan by Lynn Genet, Genet. But I got a caller here, and who the caller is?
Richard?
Richard?
I think Richard.
Let's take Richard's call, and I'll come back to the book called The Plan. Richard, how you doing?
Oh, pretty good. Yes, I'd like to know what's good for regenerating damaged nerves.
Any particular part of the body?
Yeah, the optic nerve.
Yeah, difficult question, actually. The optic nerve regeneration is very difficult to obtain. I typically, at the end of the day, in addition to fixing the diet, in addition to giving the intravenous omegas to try to repair that, usually what happens, I end up referring out to an ophthalmologist who does stem cells, because the stem cells is probably the best way to try to regenerate the optic nerve, and that's a very specialized procedure it's a very delicate procedure, and there's only a few people around the country who I know personally who actually can do those kind of procedures in terms of trying to address the optic nerve. I certainly don't do that procedure. What we do in our practice, though, individuals come in and we serve as a consultation referral source to identify for individuals where they can go to get that type of high-tech work done, whether it's in California, whether it's in Florida, whether it's over at the Cleveland Clinic. But there's a number of places you can go, not as many as I would like to see, but a number of places you can go where they can give special treatment for the optic nerve. At home, the only thing you can do is really adjust your diet. Make sure you're taking the omegas. Make sure you're throwing as many flax seeds in there as you can. I like to encourage people to use their coconut oil in the early morning shakes. Again, trying to get all the appropriate nutrients on board to try to rebuild the fibers around the nerves, which would include the optic nerve.
All right. Okay. Thanks, Doc.
Thank you for the call. Just before that question, I was beginning to raise the issue of the book called just THE, Plan, PLAN, by Lynn Genet, just GENET. It's a wonderful book, and it's probably the best book I've seen, because it talks about weight loss, but it talks about weight loss not by giving you a diet, but helping you decide what foods you're allergic to, helping you decide whether or not you may be walking around with a fungal infection. She says in the book, one of the things, and I've tried this with patients and it works, if you want to see if you have an allergic reaction, if you have an ongoing fungal infection giving rise to your bloated belly, what you do is the night before, you can drink 2 glasses of wine, 2 pieces of chocolate cake, or whatever sweets that you like, and a heavy dose of balsamic vinegar. And then the next day, you look and see if your tongue is white. And it helps you determine whether or not you're walking around with a fungal infection, sort of a poor man's test of fungus. If you don't indulge in alcohol, you just take extra balsamic and extra doses of the sweet cake at night, and you see what happens in the morning. Because often people say, why is my tongue white? Why is it coated with this white material? For many people, that's going to be a fungal infection. But the larger issue is that her book does a good job in helping you decide about all the food allergies, whether it's the oatmeal that's causing you to have the food allergy, whether it's your avocado you take that's causing you to have your food allergy, whether it's the berries you eat that's causing you to have a food allergy. I learned from reading her book that blueberries cause me to bloat. And I love blueberries, and I thought having all these great antioxidants from the blueberries. But I kept realizing that every time I eat my blueberries, I have a big belly. I'm saying I didn't eat that much. Why is my belly big? and it was the blueberries for me. So for me, blueberries and white bread makes me bloat within a half an hour. It looks like I ate a huge meal, and I'll still be hungry, but my stomach is bloated as if I've eaten a whole Christmas or Thanksgiving dinner, and that has not occurred. So on a personal level, it's all about genetics. And in some levels, it goes against the grain for what is healthy to eat. So when we say what is healthy to eat, that's in a kind of a generic way. But each one as individuals have to decide what is causing your belly to be the size that it is if you happen to be unhappy with it. If you don't fix it, it's not life-threatening. But for those who are concerned from an aesthetic standpoint, you can reduce, most people can reduce the size of abdominal girth substantially by increasing the bowel movements, by avoiding carbonated drinks, by eating slower, and by evaluating an allergic response, or they have an allergic response to any of the foods they're eating. Our friend here is eating kale chips. You're eating, so super healthy, but you could possibly be allergic to kale chips. I mean, kale is a great superfood, but if you're allergic, you're allergic. So you have to make a decision at a personal level whether or not your food you're eating, even though it may not impact your kid, may be okay for your kids, may be okay for your spouse, but for you, it may be a problem. So again, it's a personal decision. I thought for a minute my granolas was causing me a problem, but it was the blueberries I was putting on my granola that was causing the problem that would make me bloat. Sometimes I say I'm just going to bloat tonight because I want my blueberry. So we just need to know that. It's just you need to be educated, you need to be aware. When we don't think it translates into any particular disease process, we don't think it translates into a cancer, but it's all about understanding why my body does what my body does. And the more you understand that, the more you're empowered with information, you're in a much better position to make decisions about food choices, food selections, about where you go for dinner and why you're choosing what you're choosing, because many of us really don't understand what is transpiring.
Doc, I know, and I like what you say the best. It doesn't matter if you're eating a fast food place or a 5-star restaurant, you're still getting the toxins that are taking you out either way.
A toxin's a toxin. Don't care if you're being from a fast food restaurant or you're eating at a sexy 5-star facility with a fireplace and with even every one of you at the table have your own personal waiter. Doesn't make a difference. It's not the environment that determines whether the food is healthy or not. It's where is the food being purchased from, and none of us really understand our kitchens at home, more or less the kitchens at the restaurants where we choose to eat from, in terms of where they're buying their food. So if you have the time to make the inquiries, do so to find whether or not there's GMOs in the food, whether or not whether it's genetically modified, whether or not there's high fructose corn syrup, etc. But you have to take control over where you buy your food.
Hey, Doc, we talked the other day, and it struck a chord to me when you asked me how many bowel movements do I have a day. I told you
confess
one,
on air,
and you looked at me like, and you told me to explain about my intestines and the colon, and I go, makes sense, makes total sense. So, and I asked you, what do you think about the colonics? And I said, I better go get a little cleaned up here sooner or later.
Yeah, I think, and thank you for sharing your personal testimony.
Hey,
you have one bowel movement a day, and I said, I'm a personal trainer also, so we'll go to the gym, and I'll show you how to reduce abdominal girth. And the first thing I asked you was, how many bowel movements do you have a day? And you looked at me like I was crazy. I said, yeah. Said, if my job as your personal trainer is going to be to reduce your abdominal girth, then I need to know how many bowel movements you have in a day, as personal as that may be. And you politely said one, and you proudly said one, actually. But as I indicated, it needs to be 3 a day, and we talked about ways to get you to 3 a day. Cleansing, colonics, I fully support. And people should cleanse as often as they can. It's very useful. Probiotics is very useful. But you got to find a way to get to 3 bowel movements a day. And part of it is not blocking the urge when it occurs. Again, we're at KLAV, 12:30 a.m., KLAV 12:30 a.m. Please call us at 702-731-1037. 1230-702-731, 1230. We're going to go to station break.
We'll be right back.
Are you having difficulty detoxing from drugs or medication? Let Dr. Wilcox help you. Call at 702-900-2953. His revolutionary detoxing program is designed to help you detox without the discomfort of other procedures. Call him at 702-900-2953 or visit his office in Summerlin at 8751 Charleston, Suite 210 behind Fleming Steakhouse. Call Dr. Wilcox at 702-900-2953. Just in time for the holiday season, Dr. Wilcox is offering an exclusive deal for KLAV listeners. Get a free 15-minute consultation with the purchase of a vitamin B12 injection, half price, Myers cocktail, half price, or glutathione injection. For more info, call Dr. Wilcox's office at 702-900-2953. Better act fast. This is an offer on a first-come, first-served basis to a maximum of 10 patients per day. Visit Dr. Wilcox's office in Summerlin, 8751 Charleston, Suite 210 behind Fleming Steakhouse. Don't miss out on this exclusive holiday offer. Call Dr. Wilcox's office at 702-900-2953.
Just about 4 years ago, I was longboarding, hit the side of a truck. This coming spring, I will have had 7 different surgeries. I'm sent home with the oxycodone and the Percocet. The dose milligram, it didn't change, but how often I would take them did. I wanted to stop. These withdrawal symptoms are something that I wish upon no one. That's where the help comes in. I went to my doctor, Dr. Wilcox. He claimed withdrawal free. It was literally a miracle. I feel, I would say 100% better.
I'm Dr. SImmon Wilcox. I've been practicing medicine for the last 23 years. My passion has been drug and alcohol dependency, particularly methamphetamine. So what I've done in my practice is I've re-engineered how we approach the detox rejuvenation process. We offer a series of intravenous treatments. You go through a process where you don't feel any symptoms. My staff's priority is to ensure you're not having that discomfort.
For more information on this miraculous treatment, call Dr. SImmon Wilcox today at 702-900-2953. Once again, that's 702-900-2953.
You're listening to Longevity with Dr. Wilcox. The phone lines are open at 731-1230. Now, here again, your host, Dr. Wilcox.
We're back at the bottom of the hour, again inviting you to call us at 702-731-1230, 702-731-1230. Tony in the studio raised a question during the break. He said, Doc, counter to what you're saying, whenever I go out and have a fancy steak at a sexy place, it causes me to have a bowel movement. Everyone's giving bowel movement testimonies this morning. So what I said to Tony, the response, and I told him I'll answer it actually on the air, so I shall, that every time you eat, eating precipitates a reflex reaction. And that reflex reaction every time you eat should be to have a bowel movement. What you expel 1 hour after leaving the sexy place where you were eating a fancy steak is not the steak. It's what you had consumed 24 or 48 hours prior. The steak is still there. And the steak still has the potential and probably will slow your bowel movements down, because back to the rapid transit time they were seeking, and that steak, red meat, takes the longest to leave the body. Some studies say it takes up to 7 to 10 days. Most studies say 3 to 4 days. So it kind of depends. But either way, you want that food, all your food, to have a rapid transit time. The faster it expels your body, the less likely it is to become carcinogenic, causing you to be at higher risk for developing colon cancer, which, by the way, is the most treatable cancer out there, but you prefer not to have it if you could avoid it. So, yes, you should have a reflex every time you eat, whether you're eating ice cream, whether you're eating steak, whether you're eating at a fast food restaurant or you're eating at a 5-star restaurant. that reflex should occur. It's a natural occurrence, and that reflex is what helps us to have 3 to 4 bowel movements a day. If that is not happening, one has to sit down and reassess what's transpiring, probably talk to their doctor about how do I get to a better place in terms of having multiple bowel movements. It's useful for both decreasing the abdominal girth. It's also useful for losing weight. When I used to compete professionally and they weighed me in, my thing was I got to go have a bowel movement and get rid of these last 2 or 3 pounds so I can make weight today. So the stool is not weightless. The stool carries weight with it, and you want to get rid of it both from an aesthetic standpoint for many of us, but from a health standpoint, you really want to have 3 to 4 bowel movements a day. And Tony, I can say to you that you probably want to limit how often you eat the red meat, only because at the end of the day, it's going to cause the prolonged transit time. But thank you for testifying on radio about your intimate events. So one of the things we often wonder, so Doc, what else can I do? Was the other question that came in to help protect my bowel, to decrease the chance of me being the 1 in 5 individuals who actually develop colon cancer. What else can I do besides eating the right foods that increase my transit time? One thing you can do is take probiotics. Probiotics will help deliver the right culture, the right type of bacteria to the gut. If you happen to be on a number of antacids because of gastric reflux, which many people are, you want to take vitamin B12 because vitamin B12 will give you back the functioning of your what's called your intrinsic factor to help your absorption that's occurring. And something most people don't remember or don't realize, an aspirin a day keeps the doctor away when it comes to bowel movements and bowel cancer. That there's a significant reduction in the incidence of bowel cancer for those who take an aspirin a day. Many of us associate aspirin a day with the cardiac issues and decreasing your chance of developing the cardiac arrest and decreasing the intensity of the cardiac arrest should it occur. That is absolutely true. But the hidden benefit of an aspirin a day for men and for females is that it drastically reduces your chances of developing colon cancer. You don't need a prescription for that. You walk into your grocery store, your Walgreens, and you pick up your aspirin a day to help reduce both the chances of developing the cardiac event and reducing your chance of developing colon cancer. Again, we invite you to call us 702-731-1230. We invite you to visit us at our office in Summerlin at 8751 Charleston, just behind Fleming's Restaurant on the 2nd floor. More than glad to entertain your questions in detail. More than glad to just serve as your consultant and send you back to your doctor with this information that you may not have possessed before, and let you and your doctor work out the details. We're simply here as an agent of change relative to your health care, trying to empower you with information that allows you to make the right choices so you can have true longevity and have control over that longevity and not have to reach 70, 80, 90, and 100 and be crippled and compromised or in a nursing home. So that's what we're trying to achieve here. We again want to thank you for listening to us today. We'll be back on Monday. We're at KLAV 1230 AM, KLAV 1230 AM. Please call us at 702-731-1230 or visit us at 8751 Charleston, 8751 Charleston. Come see us. Thank you much.